We'll have an overview of the RFP, how to apply, application assistance, and Q&A. I can share a link to the application materials in the chat. And then as an FYI, this conference is being recorded and will be posted to the page for this RFP. Additionally, we'll be collecting any questions that you ask either in the chat or at the end, and we'll be posting answers online as an FAQ in the RFP document library. My name is Cassie or Cassandra Hunter. I use she, her pronouns, and I'm a provider relations and contract specialist with the Behavioral Health and Recovery Division in the Department of Community and Human Services. I'm joined by a couple of my colleagues today. I'll let them go ahead and introduce themselves. Sean, if you're able to unmute and do a quick introduction and why you're here today.
Hi, I'm Sean Davis, he, him pronouns, and I am the manager for the provider relations team.
Thanks, Sean. And then Andrea, do you want to quickly say why you're here?
Hi, my name is Andrea Howerton, she, her pronouns. I work in the DCHS Contracts and Procurement Unit supporting Cassandra and Sean on this RFP.
And then we might also be joined later by Reginald Cole, and he is a program manager who assists with technical assistance for agencies who are applying for funds. So in the chat, if you don't mind, I would love for people joining us to share your name and organization you're with. You're also welcome to share your pronouns if you use pronouns. And just as a quick FYI, I am working through some long haul COVID, and my cat is being quite rambunctious right now. So thank you in advance for your patience. My brain's working a little extra hard these days to keep up. And so when we get to the Q&A portion, there may be some times where I need to circle back to your question and just ensure that I'm recalling things accurately. I want to make sure that I'm getting you the best information. My colleagues Sean and Andrea will be making note of your questions. You may see me look down and jot down some notes as well. And then we'll also be making note of any answers that we are able to provide today. And then I'm going to meet with my team to just address any outstanding questions. And we will gather all of those answers and questions into a FAQ document, and that's going to be posted to the document library for this RFP. So first, I just want to start out with a background around what ARPA is. So ARPA is the American Rescue Plan Act. It was passed by the 117th Congress on March 11th, 2021. It included $350 billion for eligible state, local, territorial, and tribal governments across the United States. The U.S. Department of Treasury distributed $631 million of this funding to King County, and that's to provide additional relief to address the continued impact of COVID on the economy, public health, local governments, individuals, and businesses. So ARPA is the funding for this particular RFP. It's federal funding, and it can have pretty different requirements than some of the other funding sources that DCHS and BHERD manage. As such, it's important to highlight those requirements before getting into the details of the RFP. The reporting and documentation requirements are pretty extensive. Awarded programs must comply with federal and contractual requirements. Contracts are going to be using a cost reimbursement method for payment because of those federal reporting requirements. And eligibility of an organization's proposal is going to be determined at that time of review. It's important also to note that anything funded by ARPA can't be funded by another funding source, and it can't replace an existing funding source. So as we get into the details of this opportunity, I want to take a second to frame it through King County and DCHS's commitment to equity and social justice. And part of that is to ensure that all people, regardless of who they are and where they live, can thrive with full and equal access to opportunities, power, and resources. King County has seen an increase in unmet behavioral health needs due to the COVID-19 pandemic, particularly among communities already burdened by the effects of systemic racism and oppression. For background on this particular RFP, County Council allocated $2 million to respond to that increase in need by designing and implementing culturally appropriate behavioral health services for communities in King County that have been disproportionately impacted by COVID-19. As we know, culture is inherently important to effective behavioral health care. It impacts practitioner trust, the appropriateness of any particular methodology, how we perceive, express, and treat distress, and many evidence-based models of care center the norms of majority populations, which fall into a service client model that's not really tailored to or reflective of the current and historical experiences of minority communities. So what we're doing is looking to fund multiple proposals at around $200,000 per award, with the anticipation that some proposals may ask for more and some may ask for less. If awarded, those proposals are going to be subject to negotiations during the contracting period. Once awarded, proposals will be funded through December 2023 and is contingent on County Council approval of the 2023 budget. The culturally appropriate behavioral health services RFP was based on both data, so quantitative data, as well as qualitative. We conducted both research as well as interviews with subject matter experts. The data that we reviewed covered 2018 through 2022. And the findings showed that populations who experience higher rates of systemic and historical oppression, micro and macroaggressions, and barriers to care had higher rates of unemployment, adverse health events, unmet medical needs, and frequent mental distress. And all of that was exacerbated by the pandemic. This data highlights the need for creative ways to address behavioral health in Black, Indigenous, Asian American, Native Hawaiian, Pacific Islander, and LGBTQI communities, as well as youth, refugees, and immigrants. And that data is what informs our target population, or who is considered disproportionately impacted by the COVID-19 pandemic for the purposes of this RFP. As mentioned earlier, these reports also pointed out that often the kind of behavioral health support that individuals need fall outside of that Euro-capitalist-centric medical necessity criteria and insurance coverage standards. And then for the qualitative data section, in 2021, King County conducted interviews and focus groups with dozens of subject matter experts to identify the components of culturally appropriate behavioral health care and then how that care can be improved. Respondents gave us some amazing information, and it tended to fall to 4 key components of culturally appropriate treatment. The first is that service providers need to reflect and understand the cultural background of the people that they're working with. 2 is that services are creative and flexible. They're offered unconditionally in a manner, time frame, language, and setting that's meaningful and appropriate to the person who is being worked with. And regardless of that person's immigration or benefit status, ability to meet predetermined eligibility criteria, or other factors that impose barriers to necessary treatment. The third was that data is disaggregated, detailed, and interpreted to show who is and is not being served, how and by whom they are being served, and how they're responding to treatment. And then the fourth was that services incorporate and strengthen communities, families, schools, support networks, and other systems. Interviewees drew attention to the complex service needs of minority communities. Much of it falls outside of traditional insurance coverage or that medical necessity criteria. These unfunded services are necessary to explain complex and unfamiliar paperwork prior to enrollment. It's necessary to coordinate referrals, to build trust and lower stigma, provide education to other service providers or community members or within schools. It's to outreach people who are difficult to locate or engage with, to provide intervention before a behavioral health need reaches that clinical threshold for diagnosis and treatment. And it's also to stabilize, engage, or improve behavioral health in a manner that's relevant to that individual and that might fall outside of that medically accepted model of care. So for the RFP scope, what we're looking to do is to define, create, and expand community-driven behavioral health treatment and interventions to support creative, culturally relevant interventions for improved behavioral health outcomes, and also to provide support and intervention at a time and in a manner that best meets the needs of the individual. And again, we're anticipating multiple awards at approximately $200,000 per award. The scope of work is based on the needs of communities that have been disproportionately impacted by COVID-19. So as we had listed earlier, and then are experiencing unmet behavioral health needs. So those disproportionately impacted communities are further defined in section 2B, that data section of the RFP. But just to quickly summarize, Black, Indigenous, people of color, LGBTQI+, youth, refugees, and immigrants. Programs funded through this opportunity will seek to do several things. One is to define how culture and language impact access to behavioral health care for the people who are receiving those services. It's going to identify gaps in or barriers to meaningful, timely, and time-appropriate behavioral health care. It'll improve access to and engagement with behavioral health treatment or improve related behavioral health outcomes, provide or expand meaningful behavioral health treatment and support, and strengthen relationships between and among communities and providers. So for eligibility, to achieve the objectives of the project, we have a few examples of anticipated activities, but this is certainly not the limitation of what we're expecting. So some anticipated activities could be outreach, engagement, and education on behavioral health services and resources, the design and implementation of programs and interventions that are appropriate to the language and culture of people who are receiving services. It could be the expansion of services that are already being provided, but just aren't covered by existing funding sources. And then there's also the creation of culturally appropriate care guidelines, assessments, materials, and tools so that we have better ways of measuring our data that is not based on those more Eurocentric guidelines and tools. Then the U.S. Department of Treasury provides additional guidance regarding eligible use of ARPA funds, which are to support the recovery from COVID-19. The funding can be used to support the following. So there's direct personnel costs, so program staff, including salary, taxes, and benefits. And it's important to note that hourly timesheets are required for all staff, including those who are salaried. There's administrative and operational costs like materials, supplies, communications, building rent, and utilities, all of which are billed in proportion to the time and the use for that funded program. Staff training, equipment or costs associated with supporting participant access to programming across a variety of modalities, so like online or telehealth, costs associated with outreach, transportation access, direct client assistance for participating in and benefiting from the program, and then subawards, which are also subject to all of the federal reporting and documentation requirements. So proposers are asked to design a program using those pre-approved expense categories. But if a proposal includes a category that's not among those listed, King County will review the proposed expense and assess whether it's eligible. Just because we're reviewing it doesn't mean that eligibility is guaranteed. So resulting contracts will reflect that determination. And so for ARPA reporting requirements, as I mentioned earlier, federal requirements for ARPA funding are pretty extensive. Funded organizations will be expected to meet all reporting requirements associated with ARPA, as well as some of the other federally mandated stipulations that are outlined in that attachment A on the RFP site. Documentation and verification paperwork required may include, but aren't limited to, hourly timesheets, general ledger and expenditure detail report, non-duplication of benefits form, self-certification attestation forms for all service recipients, logs, and complete backup documentation supporting costs. And then as a recipient of federal funds authorized by ARPA and administered by King County DCHS, proposers are also going to be required to meet baseline requirements for grantees of federal rewards, which includes things like the civil rights requirement, lobbying certification, cost certification, and there could be additional requirements as well. So just carefully review the federal award terms and conditions that are included as attachment A for this RFP, and that should outline most of the documentation that we're going over today. And then lastly, King County requires that funded entities incorporate practices that challenge systemic and structural racism and oppression, adhere to contract requirements outlined in the DCHS BHERD contract boilerplate, as well as that scope of work that ends up in the provider manual. And then there's also requirements like submission of insurance and record keeping. And then also potential reporting requirements on program data, which could include demographics, activities, outcomes, or narrative summaries. So for the RFP timeline, for those of you who have looked at this document before, you may see that it has changed slightly. So the RFP was issued on May 6th, and today is the bidders conference, May 24th. The final day to ask questions, to have those appear in that FAQ document, is June 14th. And then applications are now due on July 7th. They had been due on July 5th, but we received some feedback that just a couple day buffer after that holiday would make the application process a little easier. So applications are now due July 7th at 2 p.m., which means we've pushed back that evaluation period one day, a couple days as well. So that will now be July 8th through July 22nd. There is the possibility for additional interviews if we're not able to make it a determination based on the written portions of the proposals. but that shouldn't change the notification period too much. So notification of selection and non-selection should occur within the end of July through beginning of August, and then that contract start date should be in Q3 of 2022.
Cassandra?
When designing your proposal and completing the narrative questions in the budget narrative, think about how it meets that scope of work description, the anticipated activities in the target population, those disproportionately impacted communities that we mentioned, and map that to the rating criteria that's summarized here. Think about the type of service that you're providing, who you're providing it to, and then all of the logistics. So who's providing it? How are they providing it? Where? How often? And how much does it cost? And then lastly, my recommendation is to aim high with those proposals, because the amount of your request is not how you're scored. You're scored on the strength of your proposal. So as you'll see here, the RFP rating criteria are mission and vision align with the scope of work, demonstrated experience and expertise providing behavioral health services to that target population, demonstrated deep experience working with and understanding the needs of the focused population. The proposal clearly describes the proposed program model, how it reflects and is responsive to the priorities that are listed in that section 2C of the RFP, as well as the community identified needs. That the proposal ensures staff and services are responsive to linguistic, cultural, and accessibility needs. That the proposer illustrates an understanding of equity and the context in which culturally relevant services are provided to the target population of the RFP, and describes a plan to provide those culturally relevant services. And then we're also looking for a demonstrated commitment to equity and social justice through leadership, staffing, program design, and service delivery. Submitted budgets need to be complete and aligned with the proposed activities, and consider the full scope of funding that's needed to support that proposed program model. Oops. The proposer fully and transparently addresses questions related to management or accounting of government funds, audit findings, and financial management system, as well as information on capacity development or mitigation strategies, all about sound stewardship and management of funds. The proposal outlines interest in and capacity to meet all of those reporting requirements that are associated with ARPA and with DCHS. As well as the ability or capacity to meet those DCHS backup documentation and reporting requirements. And then lastly, that the proposal identifies what program success will be and how it's measured, as well as an interest in building data capacity. So lastly, the proposal submission. So they are due July 7th by 2 p.m. They do need to be submitted through Zoom grants, and it has to be complete application, and it really does need to be submitted by 2 p.m. on July 7th. We can't accept applications after that. Attestations, as you can see in that list of documents that are required, attestations include a willingness and ability to meet federal requirements. Then there's also the zip code service intent, summary questions, narrative questions, and then that budget and the budget narrative. There will be an opportunity to request technical assistance for applications for small agencies. It's on a first come, first served basis, so there's limited availability. Technical assistance requests have to be received no later than June 14th at 2 p.m. So same time and date as the last time to submit questions for that FAQ document. when we release the FAQ after this presentation, we're also going to include instructions on how to request that technical assistance. It's for a 30-minute block of time between 2 and 5 p.m. Currently scheduled for Friday, June 17th and 24th. And with that, I'm going to turn it over to my colleague, Andrea, who's going to walk us through how to do Zoom grants.
There actually was one question that came in the chat. Cassandra, do you want to answer
Okay.
that now?
Yeah, sure.
Okay. From Nicole, it says, we bill through Medicaid and receive Medicaid funds. Would this qualify as federal funding, preventing us from applying for these ARPA funds?
So not necessarily. You can bill for Medicaid. You just can't use this funding to supplant or replace a service that is already being billed to Medicaid. But if it's for something that isn't covered by Medicaid, then absolutely you could apply for this to help if there are like additional services for a client that don't qualify for that Medicaid funding. Yes.
Okay. Hi, everyone. If you joined us a little late, my name's Andrea Howerton. I work in the DCHS Contracts and Procurement Unit, and I'm supporting Cassandra and Sean on this RFP. So I just have a few things about Zoom grants. As Cassandra just stated, proposals must be received through Zoom grants no later than 2 p.m. on July 7th. We really encourage you to try to submit earlier than that time in case there is any technical errors. If there are issues or if you're having any kind of problems with Zoom grants, please email me at this email address here as soon as you can, so we can work through that and possibly get the Zoom grants help desk involved so that we can get your application submitted. If there does come down to it, the time that and it's not working, we can accept applications via email, but we can work through all that if it comes to it. Please be sure to check Zoom grants regularly for any updates, including the amendment that will include the recording from today, all the Q&A, any Q&A that come in through email. We'll also include the updated timeline with the new due dates and all that. So please check Zoom grants regularly. We'll try to send out a communication as well if anything is uploaded. Next slide. So these are just 4 helpful things to know regarding Zoom grants when you are submitting your application. Number 1 is the Zoom Grants University. This is sort of a virtual help desk for you with free FAQ and common topics to go through the system. It's pretty helpful. They have step-by-step guides and videos for you if you're having any questions or any issues and I'm not able to help you or you just want to search on your own. The other thing about Zoom grants is it has an auto save feature, so you can add your responses into the fields, and as soon as you click out of that field, it'll automatically save for you. And as you're moving through it, it'll go through that, so you can go back if you need to do something else. You can log out of the system and log back in, and it'll save all of your work. One thing about Zoom grants, however, if you are completing your responses on, say, a Word document and then copying and pasting, Zoom grants does not like formatting, and so it may cause issues with submitting your application. So when you are copying and pasting, just make sure you take away all the formatting for that to be able to save. Zoom grants also uses a tab system. So you'll see when you enter into the application, there will be different tabs at the top. The tabs will say those categories that Cassandra just talked about, the summary questions, the narrative questions, and then any documents that you need uploaded. Just move through each tab and you'll see where you need to respond as you move through the pages. Once you're done with your application and you click submit, Zoom Grants will double check your application for you for completion to make sure that you have included all required fields before your application is submitted. Once that is complete, you can hit submit and it'll tell you that your application has been submitted successfully. And again, that will be by 2 p.m. on July 7th. Next slide. Okay, and so now I noticed that Reginald has joined us to talk about grant application support that Cassandra mentioned earlier, and he can go more into depth. So Reginald.
All righty. Glad to be here with y'all. Name is Reginald B. Cole, pronouns are he, him. I am with the grant application and capacity building support team within the Department of Community Human Services. And we're doing a handful of things. One, me and my teammate, Amy Pock, at times provide direct grant application support and capacity building for organizations. The grant application support is for when folks are applying to RFXs, whereas the capacity building is once folks are awarded a DCHS RFX, then we have multiple different supports for them on the back end, such as paid consultants, support with everything from HR to fiscal to equity and social justice, etc. It's a project that we're building off of work that's already been being done around the county, and we're really looking to enhance that, and glad that we can begin to offer that for y'all here. Next slide. So in terms of goals for today, want to make sure that y'all have just an overall increased understanding of how to enhance your RFX application by being clear on what's being asked of you overall, answering questions quote unquote evenly and succinctly, understanding the importance of scoring criteria, fitting your programs into framework of the RFX, and mimicking the scoring process provided to you via the scoring criteria. And if RFX hasn't been covered yet, the X really is just a placeholder for anything from a request for applications to request for proposals to request for qualifications. We just have different types of requests that we put out there. Next slide. Okay, so the way we'll go about achieving those goals is we'll talk about RFX's overarching themes, the questions and answer section of an RFX, the scoring and criteria section of RFX, communicating your program when you are completing your answers, as well as mock scoring. What I will also say is around these goals and these items to be covered, to the 30-minute time slots that were mentioned earlier, we would be able to go in more depth in any of the things that were on this slide. So ideally you walk away again with that general understanding and a higher level of comfortability, and those 30-minute time slots will provide one-on-one attention to talk more about any of these points that you would like to cover. Next slide, please. Also, feel free to, whether it's in the chat or even if you want to come off mute, ask any questions, that's just fine. In terms of the overarching theme, what we mean here is a lot of times folks will look at an application and they'll start looking at the questions, and they may just answer the questions, but not necessarily catch the paragraphs within the RFX that basically say, hey, here's what we're all about, and here is our scope and our request. So you definitely want to make sure you're checking out that section, because sometimes target populations and applicant eligibility will be there. And even if a question doesn't specifically call out for that, your ability to speak towards those target populations and applicant eligibility can really help strengthen your application. And in terms of the scope or request, some applications lean more towards, here's exactly what we're looking for, and we want you to apply and tell us how you can complete the request that we're looking for. And some lean towards, we have a target population that we want you to serve, and you can do your program however you seem fit, as long as you're achieving the goals that we state. So you want to make sure that you're looking at the scope and request and seeing, okay, kind of where is this? How does my program align with this overarching theme and this scope? And let me make sure that if it's not asking for a lot of specifics, let me not be weary of really putting my program out in the forefront. And on the other hand, if you are seeing some specifics and you're saying, well, our normal program mostly fits, but there's a few pieces that are a little bit off, you want to make sure that you address those and either add to your program, and if that makes sense for your program, as well as just kind of think to yourself, is this the right fit? So definitely make sure that you're checking out that scope piece to see how tight that window is or how open that is for you. Next slide, please. All right, so the question and answer section. Anytime you look at RFX, you'll have some questions and answers that are unscored and some questions and answers that are scored. So these here, I'm talking about the question and answers that are scored and that are directly linked to the criteria. On top of everything that you're looking at, you're really going to make sure that you have full understanding of these questions. And if you do not have full understanding of these questions, whether it's during a meeting like this or by asking a question via email or through Zoom grants, et cetera, you want to make sure that you get your questions answered, because the team will respond to your question to all applicants, so that you are really making sure you understand what they're asking. Because if you don't understand what they're fully asking, your ability to get all the points from the criteria is a little bit limited. So first and foremost, in terms of questions with multiple parts, sometimes you run across a question that has multiple parts, A, B, and C, or sometimes it won't say A, B, and C, and you just kind of notice, oh, this is saying two things. You want to make sure that you're addressing every element, because the review panel, as they are reviewing your application, if there are 5 points, 10 points, et cetera, available for a specific question, and you only answer part of it, you don't want to leave that up for someone to guess or to feel, oh, I really like part of the question, not the other part. And some folks get higher points and some folks get lower just because it's hard to judge. So really, really make sure that you're answering each part equally, versus leaning heavy to one and heavy to another, unless it calls out for that. In terms of word count and word distribution, that kind of goes a mixture to the multiple parts, as well as to sometimes folks will, let's say there'll be 5 questions in a row. Like, okay, this one, it's again, it's a multi-part question, and of the 3 parts, I gave 1,000 words to the first part, 500 words to the next part, and only like 100 words to the third part. That could work if, say, part C, that third part of that question, is a shorter question and it's closer to a yes or no, very question that's not looking for a ton of description. And again, if you're not clear on that, you would want to reach out and say, hey, I just want to get clarity. I'm interpreting this question in this way. Is this correct? Am I missing something here? And then we'll answer your questions as best as possible. But each question will have its word count, and you want to make sure that you're using that wisely, especially within the question that has multiple parts. Grammar and spelling. Please do not stress over grammar and spelling. Some folks say, oh, we cannot apply to this because we don't have a grant writer, or we don't have anyone that specializes in this, or we got to edit it 5, 6, 7, 8, 9, 10 times before we submit. With Zoom grants, you actually have the ability to submit and then go back and make updates. And especially with technical errors meaning on Zoom grants side of like from a technology standpoint of things like internet or servers or technology, you're better off getting your application in and then saying, okay, now let me go back and work on some of those things. At least I know I have it in. And if I did hit the submit button and it told me, hey, you're missing something, at least I know that early rather than at the last second. And one of the biggest things we've noticed that people run into, to the point that I spoke on earlier, is folks will be working in Zoom grants and then they will click outside the box and they will start blinking save. And as we said, if that save button doesn't go away after just a couple seconds, it's actually not saving. So make sure that you are doing your work outside of Zoom Grants so that you have that extra copy, so you can always copy and paste in, and without that formatting. And that way, if it does start blinking, saving, and the tool is giving you any issues, you still have all your answers written out. And then also, tools outside of Zoom Grants will help you out with that grammar and spelling. But again, not the thing to put all your time and attention on. You really want to put your time and attention on, did I fully answer the question so that I'm getting the full amount of points? And the last piece here is providing heartfelt and passionate answers. Sometimes folks will just answer the question and only focus on the criteria, and in essence have an application that's strong, but may lack a connection to the community, may lack a connection to the clients that they'll be working with, may lack connection to the reader of, hey, I'm really passionate about this. So yes, while we want you to directly answer the question and we want you to speak to the criteria, as you're hitting those things, make sure that you're adding that passion, weave it in however you want to make sure that you include that, because over time, we as King County, we've been listening. The Department of Community Human Services, we've been listening. And we really want to make sure that folks that are coming to the table are representing the communities that they serve. And a lot of times the community is saying, hey, we'd like more folks that represent our community, that can speak to their experiences with our community. So we definitely want to hear that. So know that that's not the type of thing that's frowned upon. Worst case scenario is if you only shared your heartfelt passion and didn't fully answer the question and didn't look at the criteria and said, hey, but we told you, our connection to the community, we told you our story. It's a mixture of both and. So you want to make sure that you're hitting all of the above. Next slide. Okay, scoring criteria. So I can not harp on this enough. Reviewing the scoring criteria for full understanding is extremely important, because even if you feel like you fully understand the question, if you don't fully understand the way that you will receive points, that can still throw you off. And at the end of the day, folks will contact us internally and say, hey, do you think I should apply for this? Or like, do you think, what are the chances I'll get in? And it's just like, there's no magic bullet that we have that are influencing these processes. It's similar to being in a school classroom where a teacher says, here's the rubric, 1 point, you can get 1 point for this type of answer, 3 points for this type of answer, and 5 points for this type of answer. We call out for you on the criteria sheet what that looks like. So please make sure that you are reviewing that document. If you have other people on your team that are supporting you with this process, you're reviewing it. If you're having a team meeting, make sure that you as a team are really grasping this, because a lot of times folks will overlook the criteria thinking that we as King County are looking for something specific when it's really all laid out there. Secondly, scores determine your progression through our process. What does that mean? So I'll use an example of a past grant I worked on. We had roughly 90 applicants, and of those 90 applicants, we were probably going to be able to fund about 20. And thus, one of the first things we have to think of is from a taxpayer standpoint of view, and from a objective standpoint of making equitable, fair decisions. Well, for starters, who has these top scores, right? The chance of someone having a score here and being able to be selected would be rather difficult. So just know that rather than trying to get that one unique thing or highlight that one unique person or talk about that unique mayor or that unique student, those things are good. And most importantly, make sure that you feel confident that your score is going to be up in that 80 to 90th percentile, right? Because in order to move forward in the process, you're going to increase your chances in any RFX process to move forward with that higher score. So in terms of locus of control, not being in the middle of the pack, what's very clear is someone with a score that's very low would have a very hard chance of moving forward unless there's maybe a very unique circumstance where the scope of work called out something very specific, the who's being served, there's something very unique, very specific, and or maybe there was something else in the application that left room for there to be an adjustment there, right? But at the end of the day, when you think of your locus of control, you have the ability to really make sure that you put your best foot forward, because if you're in the middle of the pack trying to make it across, it's like, okay, well, what elements about your application differentiate you enough to bypass someone with a higher score? You don't want to be in that conversation to begin with. So really making sure that you are taking your scoring criteria very seriously, as that's going to be the core element of our decision-making process. I try to press the arrow to move to the next slide. I don't have that power. Thank you. So communicating your program. When you think about these applications, again, there's the element of we have our questions, we have our process, there's our criteria, et cetera. And I did mention speaking to the heart and your connection to the work. When I say communicating your program, one way to think of it is kind of like the business plan. What is the service and or product you're offering it? What is the need? What is the end result? And what are the steps you are going to take to get there? And another way to think about it is if you've ever worked on a logic model and your logic model has its inputs, its activities, short-term, mid, and long-term outcomes, we want to know that information. Sometimes folks will put in applications and they'll have a very lengthy paragraph stating a lot of great things about their program, but it doesn't make it very clear what type of program they're doing, who they're serving, what is the frequency of their services or the length of their services? Are they doing more one-on-ones, more groups? What type? Is there a pedagogy? Is there a curriculum? What is the staff to client ratio? What locations are they at? So on and so forth. And then also thinking of anytime you maybe have read an application, been on a job interview panel, reviewed homework, anything where you're reviewing, after a while, everything kind of can feel like a blur. So the better job you can do of making it very clear and plain, hey, I'm pitching my program is unique, and here are the clear elements of my program so that you have a full understanding of it. So all that being said, some folks will have multiple programs within an organization. So organization can say, hey, yeah, we do these 3 things. Okay, great. Do all 3 of these things apply to this specific RFX, or just one of them, or just 2 of them? If it is multiple things, does that mean you're submitting 1 or 2 different applications? Or are you just submitting 1 application? That's something you want to be very clear, because sometimes we'll have applications that come through. It's not clear of all the things that an organization does, which program they're applying for. And then sometimes, even if they are, sometimes when folks will apply and talk about a program, on our side as a reader, we're reading and we go, well, this sounds like multiple programs. So you yourself making sure that you're very clear of like, oh, we've always talked about it as one, but actually outside looking in, it may seem like multiple. So being clear on that portion. And thirdly, is this an extension of your current program or a new program? Oftentimes, there'll be some confusion around, it sounds like this is a program that's already pre-existing. Is the request for us to add more money to this pre-existing body of work and just continue this body of work? If this program is working with 30 clients, are we extending it and making it so they can work with 60 clients? And then in terms of versus a new program, are we setting up something brand new? Is there potentially going to be a month to 3 months of build-up time, of recruit time, of building out policies and procedures? We want to make it very clear what's happening there, because as long as we know, oh, okay, this is where the dollars are going to, and the ratios make sense, the program makes sense, et cetera, it makes it a lot easier for us to be able to navigate your application. Next slide. Okay, And I would say this is my favorite that I know takes a lot of time. The good thing is with this application, you all have a decent amount of time to really make sure that you make time for this. I speak of mock scoring, specifically saying to find 3 or more objective reviewers. And when I say that, I mean, you're not looking for your organization's top champions. You're looking for folks that can review your application the same way we're going to review our application. And we typically have teams of 3 reviewing, or we typically have everyone reviewing all the applications. So if you have objective reviewers that actually sit down with your application and sit down with the scoring criteria and go, scoring criteria says you're looking for this and there's 10 points available. Question 1 says this, looks like a 7. Next question, available to get 5. This kind of looks like a 2 or a 3. And then that objective person can write notes saying what could move it from a 7 to a 10, what could move it from a 3 to a 5, etc. That process would be invaluable because, again, you are mimicking our process. And the more you can go about doing that, the higher chance and the higher confidence you'll be able to have in, hey, I'm in this portion of applicants. There's a very high chance that that's the case. And what's also right there is if you weren't to get funding, but you were in this, you were right here, like right on the line, there's so more in-depth feedback we can give you when you're right there and you've already done your process. You can say, oh, we can help that better, go in depth with you there. So you want to meet with them about their process and also just kind of hear, what do they think? Sometimes folks are like, oh, I just interpreted this differently than how you wrote it. So that's good to be aware of that type of such things. And then repeat. If you get opportunity, do it once and then run it past a few people again. Yep, this looks good. And that can really support you. And then same thing, whatever answers you're developing for this RFX, and even though this may feel extensive, this should be supporting you for future RFXs as well, whether it's county or with other funders. Next slide, please.
I just want to give a time check that we have about 3 more minutes to the end. So I'm not going to cut you off, Reginald.
Thank you.
Yeah, giving time check.
Yep. So just a slide reviewing the goals. We can go to the next slide and jump into questions.
That wasn't meant to cut you off. I just wanted to give a time check for you.
Oh, no worries. The last slide was simply just a review of the goals for folks to see, hey, did what he said he was going to cover make sense? So if we want to go back to that page, that helps folks generate questions for my portion, that's just fine. But either way, timing wise, perfect.
And these slides will be available online. So we will post this presentation, a PDF of the presentation to, as well as a recording of this online. So if participants do want to look at that last slide, it will be available in the RFP library. So we have 2 minutes remaining for questions and answers. And you can also send your questions to us by clicking that contact admin button. It's at the top right of Zoom Grants. BHERD staff are prohibited from speaking directly with potential applicants about the project or the RFP until the application phase is closed. So any questions that are asked today or that are sent through Zoom Grants are going to be answered in that FAQ document that we're posting to the library section of the Zoom Grants application. And any other communication is considered unofficial and non-binding. So communication directed to parties other than the RFP coordinator may result in the disqualification of the applicant. And please check Zoom Grants frequently for any posted updates and FAQ. And with that, I'm going to pause this share so that we can see what's in the chat. Please feel free to unmute yourselves or post questions in the chat as well. Can you repeat the funding again, Danny? Can you?
Yeah, what I'm asking, I'm wondering how many folks you plan to fund, and I wanted to just make sure. I'm sorry. I missed that first part, and I just want to make sure I understand. And I'm assuming you talked about that at the beginning.
We did. And if you want a more in-depth description, this recording is online. I will blush profusely that you have to watch me do that presentation all over again, but it is there for you, Danny. So the funding is through the American Rescue Plan Act. It's federal funding. We're anticipating multiple awards of approximately $200,000, but the entire reward for this funding opportunity is $2 million. And so we also encourage you to just apply for the amount of funding that you think you need and to aim high, not low, because we're basing our scoring not on the amount of funding that you're requesting, but we're basing it off of the strength of your proposal.
Thank you so much. I appreciate it.
Any other questions? I know we're over time. Please feel free to submit questions to DCHS contracts through that contact button on the RFP page through Zoom Grants. Like I said, we'll be posting an FAQ document and we will continue to amend that as we get additional questions. So that way, any question asked by any individual, the answer is available for anyone to see. And with that, I'll stay on for a couple of minutes, but thank you so much for attending.